graduated from University of Cincinnati with a bachelor's degree in political science. He has a law degree from the University of Michigan. He has a number of distinguished accolades that we have received. A lot of, I'm gonna let you all read his whole entire bio because I think his message is more important than what the bio says, but I'm just gonna give you a little bit about what I know about Mr. Tillery from my own perspective. This man has been very courageous in stepping out on various things in the city of Cincinnati. As I said earlier, marking our first African-American chief, Mr. Dwight. He was very instrumental in making sure that happened. A lot of things that has occurred, positive things that have occurred in our African-American community can be attributed to Mr. Tillery, who still continues to live in our neighborhoods. I would say that I would not be here as your President Pro Tem of City Council had it not been for Mr. Tillery. He remembered me when I was just a high school student and I volunteered very briefly on his mayoral campaign, and at that time I was enthralled with what he was doing and never thought that I would even want to run for office, but it was when I came home from college that I ran into Mr. Tillery again. And as you know, when you coming home from college, you've already done your volunteer work. And so he was running for office, and he'd asked me as I was doing my daily walk in the Bond Hill area, he asked me, when are you going to come volunteer on my campaign? And my response was, when are you going to pay me? And I thought that would make him leave me alone because I realized I can't afford to volunteer. I just came home from college. I have loans and everything else to pay. Well, unbeknownst to me, he ran into me again and he said, I'm serious, because at that point he knew my background was in political science and I had worked up in Washington, D.C. and we had went to my house and had an interview, and at that time I realized that this is where I needed to be at. And I took a pay cut to go work for Mr. Tillery because it was that important, and what he was doing in our community was that important to me, and it inspired me to want to be involved in politics. Now, I wanted to be involved in terms of working behind the scenes, not necessarily being the candidate. But it was when he left, I was very saddened, and I really believe that someone of his character, in terms of being the true voice of our city, was missed. And at that point, I realized that it was my turn to try to fill his very big shoes. And I ran for office, and I will tell you, without his support, I would not be here. I ran as an independent, and when at a time where in our council we had 26 candidates running for office, 15 were African American, and it was in 2001 when we had the riots. And I remember the first phone call I received of telling me I didn't get the endorsement that I was looking for, and it was him. And he said, Lakita, you didn't get the endorsement, it's okay. Whatever you want to do, I have your back. Do you want to run, or do you want to sit out and wait? Without hesitation, because I heard in his voice that he had my back, I said I'm going to run. And at that point, we've been running ever since. And I definitely want to make sure that, as always, when I have the mic and I can thank him, I do so, because I know that without you, I would not be here. And I want to thank you from the bottom of my heart for making sure that I stay on course. And I will tell you, it is not always a positive battle, because him and I are so much alike, so we kind of bump heads sometimes. But it's been enjoyable to be able to bump heads with someone of his character, and I want to thank him. And at this time, I want to bring him to the mic and his because I know, like I said, I know in his newfound position, his hardest position was probably being my boss, because I was not always an obedient assistant. I always thought I had a mind of my own, but that's okay. So at this time, I want to bring up the founder, president, and CEO of the Center for Closing the Health Gap in the Greater Cincinnati.
Thank you, Lakita. I'm glad that we brought our own videographer here, because I have all of that on film now. Appreciate that. Wonderful, kind words that you've had to say, and I truly mean that. you know, Lakita called me and asked me if I would come and be the luncheon speaker. And of course, I was honored by her asking me, and because it's Lakita. When she started working for me and she started talking about running for office, maybe having an interest, I said, well, the first thing we got to do, we got to stop having people call the office calling you Kiki. That's not going to work. We got to go to Lakita. Lakita called. She mentioned about the money. And then anybody who knows Lakita knows she's tight on the money. So it was real hard to try to get her to work. You had to pay her to get her to work, and I didn't have a problem with that. I also told Lakita, I said, boy, you sure looking real good today. I said, man, I really like them shoes you got on. She said, I learned from you. I said, well, but I'm not wearing shoes like the kind you got on. Why don't you show them shoes, Lakita? Lakita got some shoes on, boy. Look at them shoes. Now, wait a minute. These boys are getting confused over there. Watch it now. Don't fall out the window. Lakita, let me tell you something. Don't be fooled by her beauty, her grace, and her charm. This is one brilliant, tough woman. I'm telling you. I grew up with 4 sisters. And boy, they was something to deal with. And Lakita was my pit bull. I always call her the pit bull. Because I never forget the very first day she was coming to work. I'm going to try to stay on point because I know you got a time thing. The very first day, and she was on her way into work, she called me about 8 something. And I was, I usually get in the office about 10, so I was still a little asleep. And she was on the phone, and you know Lakita, she talks fast. She just going crazy. I said, Lakita, what's wrong? They talking about you. They talking about you bad on the radio. I can't take it. And she was just going off and off and off. And after I said, Lakita, don't worry about it. That's just the name of the business. They're going to do that. Just relax. But I knew after that, here was a person who really was sincere and who was committed to me. And I'm deeply appreciative. And I thank you so much, Lakita, for the great job that you are doing on City Council. You are standing up for the people. And we got some nuts in our community that don't even want Lakita to be my friend. The first thing they do is attack Lakita on the radio. Because Dwight Tillery is this. What's wrong with our people? I just don't understand that. You know, rather than being proud that we're doing what we're supposed to do, those who have gone before, we should reach back, mentor our young people, and bring them to so they can have an opportunity just like we have. That's what we're supposed to do. Want to try to put that sister down, that's crazy. What is wrong with us? As she mentioned, I spent 8 years on City Council. And I was always proud of our fire division. And I want the president of the firefighters to know that. But I was especially proud of the African American firefighter. Because I understood, you know, one of the first things that I did, I started working for the city in 1973 as a lawyer. And they asked me to participate. And one of the things that was being challenged was not only the tests that African Americans had to take to get into the firefighters, but the physical condition. And hypertension was one of the big issues, I want you to know, was one of the big issues then, and I participated on that. But you know, one of the greatest things that thrilled me so much was to witness the appointment of the first African American chief of the fire division of the city of Cincinnati, my good friend, Chief Wright. Let's give him a round of applause. Come on, let's stand up. That's worth standing up for. Don't worry about standing up for me, but let's stand up for what he has been able to do. Let me tell you something. This brother did it on his own. He scored #1 on the test. But just like we're watching a lot of other stuff going on in America around these elections, we had to watch for him too, to make sure there was no funny business and that he got his just due. And I was happy to be a part of that. To the North Central Regional Director, the Honorable Kenyatta Smith, and our local President Harold Wright, thank you for all the great work that you do and that you're doing, especially in our community. It's a great job and it's a great privilege to see your leadership. Now I want to talk to you this afternoon. Am I speaking too loud? Because they say, you know, bro, you really can go, and I don't have no feedback. You know, I'm not an entertainer, so I don't know if I'm talking too loud. Okay. I want to start off by a quote from Dr. King. Many years ago, he said, and I want you to really listen carefully to this. He said, of all the forms of inequality, injustice in health is the most shocking and the most inhumane. You ever heard that quote before? Have any of you ever heard that before? Let me say it to you again. Of all the forms of inequality, injustice in health is the most shocking and the most inhumane. Hold on to your seats. I'm going to tell you what it's about. It wasn't until 7 years ago that I would have an appreciation for the true meaning and understanding of this quote. I started learning about health disparities during this time, and what I learned changed my life. Like so many others during that time period, we were deeply involved in the civil rights movement, and we were concerned about issues like discrimination in housing, employment, public accommodations, and education. But discrimination in health really wasn't one of the topics that was out there for that kind of wide discussion. But Dr. King's quote struck at the very moral fiber of this nation. For what could be more fundamental to one's life than one's health? What could be more fundamental? And yet he understood that this nation had two systems, two healthcare systems, one for whites and one for blacks. And just like the dual systems we had in this nation, the one for blacks was inferior. And as we look back over these last 200 years, we can see the consequence of segregation and discrimination in the black population of this nation. Health disparities are defined as the unequal burden in disease morbidity and mortality rates experienced by ethnic or racial groups as compared to the dominant group. Health disparities are complex, and there are many reasons that come to play that shape the health outcomes of people of this country. But the bottom line, my brothers and sisters, African Americans and other minorities in this country bear the burden of sickness and premature death from such diseases as heart disease, cancer, diabetes, HIV, AIDS, obesity, mental health, and infant mortality. While the majority of people of this nation continue to live longer and healthier, we are living shorter and sicker. We are living shorter and sicker. But what does health disparities look like? There are 83,570 African American deaths that occur each year as a direct result of health disparities. This is one death out of every 3 African Americans. And these are preventable deaths that are occurring. And these deaths exceed both the Vietnam and Iraq war casualties. Right here in America, African Americans had 41% higher rate of death rate from all causes than whites the same age in 2002. You hear what I'm saying to you? Let me give you some more. African Americans' death rates exceed those of whites when it comes to diabetes by 50%. When it comes to stroke, by 77%. When it comes to heart disease, by 47%. When it comes to cancer, by 34%. When it comes to HIV AIDS, 655%. Are y'all listening to me? Some of y'all ought to be on your cell phone, texting and calling your doctor right now. African American men have the highest incidence and mortality rate of prostate cancer in the world. Health disparities. Been around for many decades. But it wasn't until 1985, the former Secretary of Health and Human Services, Margaret Heckler, appointed a task force on black and minority health in this nation. And the report came back and said that there were significant differences in the burden of illness and mortality experienced by blacks and other minority groups in the United States. When Secretary Heckler asked the author of this landmark report, why did such disparities exist? They responded by saying, well, it's always been that way. Always been that way. In 1999, the Congress commissioned the prestigious agency, the Institute of Medicine, to provide a report about health disparities. That report came back in 2002, and it was a blistering report. The report was entitled, listen carefully, I didn't came to entertain you, I came to educate you. Unequal treatment, confronting racial and ethnic disparities in health care. Unequal treatment. There were many findings in this report, but most confirmed what people had already suspected, that race and ethnicity are significant predictors of health care quality. Race and ethnicity. The report showed that minorities were less likely than whites to receive the needed services when they went into the healthcare system. Even clinically necessary procedures. You ought to be concerned. You really ought to be concerned. The report stated that even when you control for such things as insurance, education, severity of illnesses, African Americans still receive inferior care. I don't know if you understand this, but we are in a serious health crisis in this nation. Serious health crisis. While the majority population in this country continues to enjoy the best health care the system has to offer, we are fighting for our very lives. African Americans lead this nation in obesity, diabetes, HIV/AIDS, cancer, heart disease, mental health, immunization, and infant mortality. We lead in almost every major disease category in this nation. The AIDS infection rate among African Americans, women, has doubled just in the last 2 years. Doubled in the last 2 years. But where is the outrage about this epidemic? Where are the evening news stories about this unfolding tragedy? For all the AIDS cases we have in America, African Americans, while we are 10 to 12% of the population, we have 50% of the AIDS cases in this country. Now, I will never forget back into the 80s when AIDS really hit the scene. And out in San Francisco, the white gays were really starting to die from this disease, and how the nation reacted to doing something about it. But now that over 1 million African Americans are suffering and dying from this disease, it has become a disease of color, and you virtually hear nothing about it. Do you understand what we're confronted with? This is not a gay disease. It is in the heterosexual population. Why don't you come and go with me to the nursing homes of our city? And you will see young minorities who are there because of stroke, HIV/AIDS, and who are suffering as amputees because of diabetes. Come and go with me to the dialysis center, where you'll see 8 out of the 10 people who are there who are African Americans of kidney failure. Come and go with me and see it. Young African Americans in nursing homes at age 38 and 40. I don't know about you. I'm 60 years old. And when you talked about somebody being in a nursing home, you talked about somebody at least my age and over. But these are people that are 25, 30, and 40 years old that are in the nursing homes. My brothers and sisters, for over 200 years, African Americans have borne the burden of sickness and premature death. Blacks, Hispanics, and Native Americans, we suffer needlessly from illnesses and die from preventable diseases on a routine basis. On a routine basis. For decades, the federal government has tracked the data and clearly saw the disparities. So how is it that America has all of this information, well over 2 centuries, that its citizens, people of color, were dying needlessly and reacted by saying, well, it's always been that way? How is it that America, who often use people of color for some of the most cruel medical experiments to improve the health of this nation, would now deny those same people the benefits of those experiments? Help me with this. How is it? That seems to me that there is something irrational about a nation that leads the world in medical achievements and yet deny access to health care to its own citizens, no matter what color they might be. No matter what color. There seems something almost barbaric about a nation that provides health care to those who can pay while denying it to those who can't. There seems, my brothers and sisters, something almost immoral about a healthcare system that delivers a quality service to the majority population while delivering an inferior service to the minority population. Health disparities. Health disparities are America's shame. It is the legacy of racial discrimination and segregation. It is beyond my comprehension that we have over 46 million people, no matter what color they are, without health insurance or either uninsured. We see families and individuals having to make a decision between buying their needed medication and paying other important bills. Suffering. Have you seen somebody suffer from a disease? Have you seen somebody suffering from a disease, I'm asking you? Yes. Suffering from diseases and hurting from pain is life's living hell. And how is it that America, the richest country in the world, has so many citizens who are sick, suffering, and dying, in many cases, from preventable diseases? Have you thought about it? How is it? How is it that in this country you have a constitutional right to a lawyer if you're being prosecuted for a crime, but yet if you're sick and you're dying, you have no right to medical care? Help me to understand this. Help me understand this. You're not dying because you don't have a lawyer, you're dying because you don't have health insurance in this nation. How is it that if you have committed a crime and you are incarcerated, you have a right to medical care, but yet you are a law-abiding citizen and you don't have insurance and there's no health care for you? Help me to understand it. Come on, somebody out there, help me. There are those, so many of you who believe, not necessarily in this room, that health care is a right. But there are those who believe that health care is a privilege. But I believe to make health care available only to those who can pay for it, while those who can't must suffer the consequence, even if it's death, is wrong and has no basis in morality. And to provide health care on the basis of one's race or ethnicity is equally wrong when you provide inferior health care. How is it that our taxes are paid by the working poor, not a whole lot by the rich, but our taxes have built the best health care system in the world, and yet 46 million people have no access to the very system they have helped to build. I read by the year 2015. Don't worry, I'm going to be finished in a moment. By 2015, that's not too far away, what is that, about 7 years? Healthcare will be a $4 trillion industry. Half of the money will be paid by you, and the other half will be paid by the federal government which is still you. That's your tax dollars. Yet we have not made health care available to all of the people of our nation. Now, you know, there ain't a big political thing going. We got politicians everywhere. I'm so sick of seeing them. I wish I had never been a politician before. They drive me crazy. But politicians say that the system is broke. The doctors say that the system is broke. The healthcare system says the system is broke. The health experts say the system is broke. The employers say the system is broke. But no one does anything about this broken system. Why is that? Why is that? Because somebody's making a hell of a lot of money off of this broken system. That's why that system is not being fixed. That's why that system is not being fixed. Come on, you know the truth. Making a hell of a lot of money off of this broken system. Well, having access to quality health care isn't the only problem that's facing African Americans. Dr. David Satcher, the former Surgeon General, who also happens to be African American, of the United States, said the environment accounts for 20 to 30% of morbidity and mortality. Listen to these numbers because it's real critical. Genetics, 15 to 20%. And lifestyle, oh, here we go. Lifestyle, 40 to 50%, is responsible for morbidity and mortality. 40 to 50%, my brothers and sisters, of our lives, of our lifestyle, has to do with how we live our lives and determines whether we are sick or die prematurely. 50% is in our hands. And unfortunately, so many of us have the attitude, well, you know you gotta die for something. And I don't mind telling it. And my buddy Ed, I know he won't mind telling because I love Ed Turner. This is one of my great friends. But I'm sure he's all right with me telling him, you know, sometimes we see each other in the local watering hole. So a few days ago, I'm sitting here talking to this brother who's got diabetes. And he's just drinking away. And he says to me, yeah, I don't eat right. I don't eat right. I said, you don't eat right and you're not drinking right. And then he says the classic, because you've heard it. Well, you gotta die from something. How many of you heard that? People say, oh, you gotta die for something. But let me tell you something. Dying from smoking and drinking too much and doing illegal drugs or eating too much of the wrong kinds of food is dying from nothing. That's dying from nothing. Don't be scared, honey. Go clap your hands. You may be the only one got it. They'll catch on. They'll catch on. But so many of them won't even go to the doctor. I'm not going to ask you to raise your hand. Even when we have health insurance, the studies show that many African Americans have good health insurance, but won't go. Particularly the black men in this room and in this nation. Oh, you will take that car and get the oil changed every 2,000-3,000 miles, but you won't do nothing for your own body. See what is wrong with us. Now, brothers, they already know. We chicken, we scared. They know that. The sisters always say, y'all scared. And it is because some of you scared. Because you're afraid of what the doctor might find. But I promise you one thing, if you got something, not going ain't gonna make it go away. I promise you that. Usually it'll only get worse. And if you don't go, you won't know. I can't tell you how many of us are dying needlessly in our communities. And brother, and while I'm on the brother, prostate exam. Here we go. What's wrong with us? What's wrong with us? Some of them say, I'd just rather die than not have a prostate exam. Well, you just might die and never have that exam. But I saw firsthand, my father died from prostate cancer at the age of 60. And I will never forget the suffering that he endured. Well, you know, the brothers say, well, and Herschel Chalk, who's one of the strong advocates, he was also a prostate cancer survivor, and I love this brother. What he does is just tremendous, and I want to give him a big round of applause. Because, you know, dealing with black men in health, man, that's something else to deal with, dog. So they say, well, I don't want nobody putting their finger in my rectum. Well, brothers, the doctor's not putting his finger in your rectum for his pleasure or for your pleasure. He is trying to save your life. Trying to save your life. There's a lot more I can say about that, but we ain't that mixed company. We got high blood pressure. Right. I mean, if you're 50 and older, there's hardly anybody that doesn't have high blood pressure. And many of us won't take our medicine. We say, oh, I don't take no medicine. I ain't take no medicine. I ain't. You got some liquor? You got some beer? You got some coffee? You got some sodas? You eat all kind of junk food? And some of you taking, not necessarily in this room, illegal drugs and taking those pills, but you're all right with that. But any pills that might save your life, you don't want to take it. I don't understand that. So the doctor says, okay, now you need to lose some weight. Oh, here we go now. Cut down on the salt and get out and do a little exercise. Of course, many of us say, okay, doc, and we walk right out and we go right down to Gold Star. We eat up all the chili we can. Huh? Come on. We pay no attention. We don't do what we're told, and then we wind up in the emergency room. The Center for Closing the Health Gap. We have a campaign against obesity. Let me tell you, obesity will surpass heart disease in the very near future as the #1 cause of death in this nation. Our campaign is called the Do Right campaign. Dr. Satcher says that the epidemic of overweight and obesity is having an enormous impact on African Americans in this country. Obesity, listen to this, as I know you never thought this would happen, but obesity is a major risk factor for cardiovascular disease, including hypertension, strokes, diabetes, cancer of the breast, colon, and prostate. But we don't want to talk about our weight. But let me tell you, for some of us, our weight is killing us and our children. It's killing us. I want to keep it real. Let's be honest. Some of us eat too damn much. Put down that fork and put down that knife. We eat too damn much. We gotta be honest. You eating in the morning, you eating in the evening, you eating late at night, you back up eating again. On and on and on. Go to Golden Corral. I'm shocked when I go to Golden Corral. This brother works for the Fritchies at Golden Corral. I should have put you out, brother, because you hadn't started your diet yet. But anyway. The Mott's my friend, I love him. But I thought they'd be broke by now. You see them folk going in there to go to Corral, brother. They just loaded down on plates. But you know what? We have got so used to being overweight. We've convinced ourselves that we're not overweight. We're just thick. We're just thick, that's all. We ain't overweight.
That's true. Tell it.
So many of us are addicted to pop, fast foods, fried foods, sugar, salt, red meat, potatoes, and other sweets, alcohol, cigarettes, video games, sitting around all day long, doing nothing for our bodies but cramming food and liquids all in our bodies that have no value for us. Yes, we're being targeted by the fast food companies, the liquor stores, and full-service grocery stores are abandoning our community, too often leaving us to go to convenience stores where they ain't selling nothing but stuff in a box and a can. And it's full of sodium, which only is going to rise your blood pressure and have all other kind of cardiovascular disease. Yes, our neighborhood's not always the safe place for us to walk and exercise and do what we need. But if we're going to change the health outcomes in our community, we must take our health serious, brothers. Almost weekly I hear of someone who is either sick or dying from these diseases. We must demand a better healthcare system and an environment that we live in. But we too must take charge of our health. 50% of our health depends on our lifestyle. No matter how good your insurance, your doctor would have you, 50% of what you do with your own life can make all the difference in the quality and the longevity of your life.
True.
We must bring an end to the sickness and the premature death that plagues our community. There's much that we can do. And I noticed in your bulletin, and I'm coming to a close, that you've already outlined a lot of things that you can do. How many of you have read that? How many of you will promise to read that? Well, just in case you don't, let me just tell you. Go to the doctor every year. On the average, lose 10 pounds. Now, we know some of y'all need it, well, not necessarily in the room, but there are others who need to lose more. We need to walk or jog or do some physical exercise 3 times a week. Manage our portion size. Manage our portion size. If you're on a restricted diet, stick to it. If you take medication, do it daily. If you smoke, stop. Alcohol in moderation or not at all. Don't do illegal drugs and don't participate in risky sexual behavior. In closing, I want you to understand that sickness is a terrible thing. What I continue to see in this community is disheartening. But you know, most diseases impact not only the person who has the disease, but the family, the friends, the loved ones. I don't know about you, but I didn't ask to come into this world. But now that I'm here, I want to live as long and healthy as I can. Our motto at the center is your health is your future. Take care of yourself and God bless you.